Hey y'all, this is Jennifer Rittenhouse of Amira Music Therapy, and this is part of my series of why music therapy. Why might someone choose music therapy over, say, talk therapy or ABA therapy or, all of the other types of therapies that are out there. And one that I have heard from a lot of people over the years is that music therapy is able to make someone feel very safe. And I'll tell you why that's important. First of all, a lot of people, when they enter into therapy, they will sit down, they'll start doing a session. But if you think about it, therapy asks people to do a lot of things that trauma, difficult relationships, anxiety, all of those things oftentimes that people are going to therapy for make very difficult. Take social anxiety. When you go to therapy, you are required, first of all, you got to make an appointment, right? Yikes. A lot of people with social anxiety don't like to even make a phone call. If you're lucky enough, sometimes therapists are getting better about where you can make an appointment online. But in lieu of that, you have to make the appointment. You're probably getting reminders throughout the week that there is an appointment. Anxiety spike, anyone? And then 3, so you have social anxiety. You've had to face your fears just to make the appointment. You've had reminders of the appointment, texting on your phone, sometimes emailing, sometimes other methods. And then you walk in and meet this new person. Yikes. And then you're expected to share your problems with this new person that you don't know. I mean, they're supposedly licensed and supposedly know what they're doing, but you don't know them. That's just kind of, if you picture that, or if you've ever been in that scenario before, it's understandable. While a lot of people, they will start therapy, they'll come for the first session, maybe even the second session or the third session, but the overwhelming feeling of, oh my gosh, this is so hard, this is so overwhelming, tends to stop people. And people will walk away from therapy because it is just a stressful process for them. And what music therapy is able to do is take some of the anxiety away through music. Now, I'm not going to say it's still not I can't promise that you'll feel absolutely no anxiety in a music therapy session, or things like, I can't take everything away, but a music therapist can pull out your favorite music. A music therapist can use music to regulate your nervous system and your heart rate so that you're not finding those physical symptoms of anxiety and stress. And this can all be done in a pretty casual way. All I have to do is say, hey, what music do you like? And most people are going to be able to tell me, oh, I love this band. Sometimes my teenagers like when I ask them, what music do you feel like is overrated? And they have many opinions, I promise. But with that, now we're just talking about music, something that most people can enjoy and relate to. And as that patient gets more comfortable, of course, we're going to work on different things and, start to get into more the nitty gritty, so to speak. But that music is still, I had a professor who said that was the container. It's something that can hold all of that in a safe way. So this doesn't seem like such a challenging process. And I think that is so important, especially when you're dealing with people who have dealt with so much. We don't ever want to trigger someone with, if we can avoid it. Of course, triggers can be anything, so sometimes it happens. But music has a unique way of being able to make people feel safe. And that affects treatment outcomes too, because if you're fighting to feel safe while you're treating something, you're actually getting your brain, unfortunately, your brain has these two modes. That has your baseline mode, you're feeling good, you're doing well, you're able to use your logical thinking and your personality is coming through and everything. But if you don't feel safe, you have just activated, like I've talked about in my trauma videos, you've activated survival mode. And guess what? When survival mode is on, your logical thinking is not. Your prefrontal cortex has said, bye, sorry, not in this one. And while those reactions have kept people alive, and they are so important, and I'm so glad we have them, if you have those reactions going on in a therapy session, it's going to be hard for that person to really benefit from that therapy. You got to be able to feel safe before we go anywhere else. So that is one thing I truly love about music therapy, is that it has a unique way of helping people feel safe and comfortable, even when dealing with the tough stuff.